very much.
Very much. You know, the health indices in Lagos State is the best in Nigeria. And despite that, we still have some challenges. And we feel that private practitioners that are involved in 65 to 70% of service delivery are really not being properly engaged. And we felt the most important thing is to bring in the government, to bring in the community, and to bring in AGPMPN stakeholders to come and discuss the reason why we must engage ourselves to maximize everybody's potentials. And that was what informed the town hall meeting. It's the first one that we're having in the private sector. The constitutional responsibility of the government is to provide health services to the populace. In the midst of that, we have an epidemic, which is now a pandemic. We have maternal mortality rate issues. We have other health issues that are putting us in the bad geography in the world. And we need to address all this. At the same time, agriculture is there, infrastructures are there, education is there. Transport is a menace. So we need to sit down and talk and look at the minimum cost on how to achieve a better health indices in the country. So the challenge is that initially the government were not willing to come to the table, but now they are willing to come to the table. Because the costing of health is another challenge that we need to bring to the table. They are now seeing that, look, the costing of health in the private sector should not be the same way they cost health in the public sector. Because the public are starting from a higher position. Infrastructure is not their business. Overhead cost is not their business. Water rates, other levies, taxes and all that, they are not their problem. All those are challenges to the public sector, to the private sector. So all these will increase the cost of service delivery. And those are the things that we are trying to engage ourselves. At the same time, the objective is that the health indices must be improved.
Lagos is ahead of many states in healthcare, but at the same time, Lagos has challenge of population, and also improving healthcare requires good funding, and also for us private practitioners, we need an enabling environment to be able to function. Like you are aware, we cater for close to 70% of the populace, and we need tools to work. We need support. In other countries where private practitioners are doing great, sometimes government may give them support, loan, with very low interest.
Dr. Akintade has been at our Emergency Operations Center every day. We seem to be receiving international accolades for the collective solidarity that we've shown as a community, as a state, and as a country. However, it's not over. We could receive another index case any moment from now. In fact, the chances and the mathematical modeling is increasing. So we're not relaxing. We are in a very high index suspicion state of mind. You, as private practitioners, are more likely to see cases than we are. So that's why it's important that I talk about this.
We all must work together for us to win together. We must come to terms with the fact that we are all working towards a common goal, which is delivering a qualitative healthcare services. Also, the outbreak of diseases such as coronavirus, Lassa fever, Ebola, among others, had made the need for private health practitioners to collaborate with government.
Private practitioners in Lagos State and maybe in Nigeria in particular, they have a great role to play in containing this spread of disease that is ravaging the country and the world at large. As a private practitioner, I expect every private practitioner to take charge of his or her own domain, to make sure that every case that comes in is suspected until proven otherwise.